My next question was really around, yes, so you're going to go into medicine, but why HIV and why HIV and AIDS?
I think so I had this interest in sexual health. And I wasn't very politically active as a medical student at all. I think I had a good time. And it was afterwards when I started working, and particularly working in London. I think the bit of London we both work in East London is very deprived. There's lots of health inequalities. There's a lot of communities, I'd say, that have are not heard by authorities or people who develop healthcare services. So I think that kind of made me more aware. Um, so yes, I was interested in sexual health, and I ended up doing a kind of sexual health training program in East London, um, well, which half of it was kind of sexual health clinics, and the other half was HIV. And I think it's more by chance than anything else that I've ended up doing what is now a specifically HIV job, which I love. So I do kind of ward work, so looking after patients who are very sick with HIV and AIDS, and also do a lot of clinics. And I kind of fell into it, but I found that it really suited me because I think the patients are just incredible. Like it is by far, a very rewarding specialty. It's changed so much, even in the 16 years that I've been doing it. We have effective treatment. People can live normal, healthy lives. They can have families. If they're on effective treatment, they won't pass HIV on to anybody. So this is all, massively changed in the last few decades. And the only thing, the main barrier now is stigma and discrimination. And, I feel part of my role is really trying to dispel stigma and kind of challenge those HIV myths. And in the book, I talk about patient activism and I use HIV/AIDS as an example because I think, the history of HIV patient activism is incredible. They changed, they went from having what was a terminal condition to a treatable condition within 20 years. And not only that, they kind of changed how healthcare is done, how scientific evidence is produced, how clinical trials are run, and even the language of medicine. So, I feel very fortunate to work in such a specialty that combines both clinical medicine, interesting science, but also activism. And I think there's a lot of passion in the specialty as well.